Hello everyone, in this video we will talk about the fungal infection histoplasmosis. Histoplasmosis is caused by the fungus Histoplasma capsulatum. This particular fungus is a dimorphic fungus. Dimorphic meaning two different forms. So this fungus exists in two different forms, which is the yeast form, which is seen in 37 degrees Celsius, and the mold form, which is seen in 25 degrees Celsius. So if you see in a higher temperature, you will see the yeast form, and in a lower temperature, the cooler temperature, you will see the mold form. And this is known as dimorphic fungus. Histoplasma is responsible for an infection which constitutes systemic mycosis. The particular system that it affects is the reticuloendothelial system. Histoplasmosis is also known as Ohio disease or Darling disease or cave disease. It is distributed in central USA and Africa. So this is where this infection is more commonly seen, in central USA and in Africa. The mode of infection of histoplasma is by inhalation. So the infection happens by inhalation, and the organism is present in bird droppings. If we look at the clinical features, most people will be asymptomatic. But if symptoms are present, they will involve the lung, causing a TB-like disease or leading to pneumonitis and mediastinal lymphadenopathy. This mediastinal lymphadenopathy can be seen on chest X-ray as well. So this is what we have in the lung clinical features: a TB-like disease, pneumonitis and mediastinal lymphadenopathy. In a more disseminated form, which affects the reticuloendothelial system, histoplasma will cause lymphadenopathy, hepatosplenomegaly and fever. So these are the clinical features of the disseminated form: lymphadenopathy, hepatosplenomegaly and fever. And it also causes ulcerative or granulomatous skin lesions. So the skin lesions will be ulcerative or granulomatous. In the African form, only skin or subcutaneous lesions are seen. A TB-like presentation is not seen, or lung involvement is not seen in the African form of the disease. For diagnosis, we can do a microscopy, and the specimens that we can use are blood, bone marrow, scrapings from the skin lesions, as well as lymph node biopsy. And what we see in microscopy is the yeast forms, and since we know that the yeast form is seen in 37 degrees Celsius, which is the body temperature, so that is what we will see in the microscopy from these specimens. And the yeast form will be present in reticuloendothelial cells as 2 to 4 micrometer oval shaped budding yeast cells. So this is how they appear in the yeast form: 2 to 4 micrometer oval budding yeasts. We can also do a culture where we take these specimens and do a culture on Sabouraud's dextrose agar, and what we will see are white cottony colonies. If we observe these colonies under the microscopy, what we will see are spherical spores with tuberculate projections. So this is the characteristic appearance: spherical shaped spores with tuberculate projections on the surface. This is how they will appear under the microscopy. Serodiagnosis can be done with latex agglutination or complement fixation tests. Antigens can be tested in the urine and serum as well, but the skin test, which is the histoplasmin test, is more specific than the serodiagnostic tests. Treatment for histoplasma can be given by itraconazole if it's a mild to moderate infection. So for mild to moderate forms, we will give itraconazole, and for severe forms, we will give amphotericin B.